families get ready for the new school year, there's an important yet often overlooked aspect of preparation that deserves our attention: child wellness visits. Now, joining us now to discuss from United Healthcare Community Plan is Chief Medical Officer Dr. Arethusa Kirk. Dr. Arethusa Kirk, I really do appreciate you spending some time with us this morning. When it comes to children's health care and wellness, what do parents need to be thinking about?
Well, first, thanks for hosting me today. Back to school is a great time for parents and caregivers to be really thinking about supporting the physical, mental, and emotional and social well-being of their children. So that includes getting them back into the regular scheduled well-child checks, because it helps us track screenings, tests, immunizations, and other parts of their development.
So do you have any tips to help parents and caregivers prepare for appointments?
Yeah, fundamentally, pediatrics is about prevention and early intervention. So the first is really knowing and preparing for the schedule of exams. The second is prepping for labs, tests, and immunizations. And the third is be ready for dialogue. Write down your questions ahead of time. In terms of the schedule, for that early infancy through toddler period, there's up to 8 visits before 15 months of age. But as you get into early childhood, into adolescence, the annual visit is still very important. For labs and tests, it's just important to understand that there are many labs and tests that are required and recommended, including lead testing and immunizations such as the annual flu vaccine. And then in terms of dialogue, just make sure you're writing down those questions so you can have that meaningful relationship with your provider.
Yeah, that's pretty good advice. A lot of times you get to where you're going and you're like, oh, I can't remember what I was going to ask you. So it's a very, very good suggestion. So what should parents expect from wellness visits as their children age?
Well, fundamentally, starting at age 3, you're going to have an annual wellness visit. And oftentimes we see that really drop off in adolescence because people feel like we don't really need to go anymore. But you absolutely need to continue to do that because, as I said, pediatrics is about prevention and early intervention. So we want to detect any signs of chronic disease or illness early so that we can intervene. While there are less immunizations as you get older, there are still really important immunizations to be considered through adolescence and early adulthood. And for all of us 6 months and age and up, the flu vaccine is recommended. And so that circle of protection for all of us getting our immunizations helps those vulnerable adults as well as newborns make sure they have a circle of protection around them.
Makes sense. Yeah, the flu shot especially is incredibly important. My wife and I make sure that we always try to get ours right around August, so that way we're protected through the fall and winter. So, Doctor, thank you very much for joining us today. We really do appreciate your time. This has been very informative. So where can folks go if they want to learn some more information?
Well, if you're a United Healthcare and Community Plan member, you can find it through the Healthy First Steps program. But uhc.com/children's wellness is a great resource for downloadable materials.
Excellent. Thank you very much, Dr. Kirk. We really do appreciate it. And folks, if you want to catch segments like these again, you just head over to FCN Plus.